everyone. Mahalo for joining us. Really thanks to Eric Honda, the head of the Hawaii District Department of Health Office. We have this rare opportunity to hear from CDC experts who are on Hawaii Island this week. Dr. Ann Buff and Dr. Katherine Center were very busy on Maui last week, we understand, helping with the response outbreak on Lanai. And we're so fortunate to have you here with us today. Dr. Ann M. Buff is a senior global health leader, medical epidemiologist, and physician of the Centers for Disease Control and Prevention. She has over 20 years of experience in strategy development, portfolio management, program implementation, and capacity building in government, nonprofit, and international organization settings. Dr. Katherine Center is a behavioral scientist with the CDC, trained in behavior change and analytics. She has worked in community engagement and communications, attempting to mitigate the spread of COVID-19. Also relative to COVID, she has worked in several states creating algorithms, running analysis, and creating graphics. Thank you all for being here. Before our speakers begin, we'd like to remind you that our guests and our listeners, if you could please mute yourselves. And if you have any questions, please feel free to submit them using the chat feature. We will get to as many as we're able towards the end of our discussion and presentation. Dr. Buff, Dr. Center, aloha. And thank you again so much for taking the time to meet with us. I'll turn it over to you folks.
Great, Miles, thank you. We absolutely appreciate the opportunity to speak to your group. We actually spoke with the chamber when we were on Lanai and had a really good reception. Our goal, so we were invited by the State Department of Health. And the way it works is CDC is a federal agency, obviously. It's the public health agency for the United States. And when states want help, they can request it from CDC. As you might imagine, at the beginning of the response, there were a huge number of requests, and CDC had a huge number of people in the field. I think at one point they had about 2,500 people helping out health departments across the United States. Because Hawaii is a unique environment, it's obviously difficult to get to, there's limited capacity. You can't just call your neighbors and they can send reinforcements. When Hawaii asks CDC for help, CDC always tends to want to be as responsive as they can be. And we try to really help out folks who can't lean on their neighbors for whatever reason, in this case, geographic travel restrictions. And quite frankly, because every single person that's in public health right now is being utilized and every health department is shorthanded. So we were invited to come. We weren't specifically there. I think there was some confusion maybe originally. We weren't specifically invited to come for the Lanai outbreak or cluster investigation. We've actually been here for several weeks. We've been working on Oahu. We're really working on data systems, data collection, analytics, trying to get all of that information that decision makers need to make decisions at the state level, but also at the county level. So we feel that it's an absolute privilege to have been invited to the county level. And anytime we can have an opportunity to speak with people, we are happy to do that. And so we know that one of the things that there's been a lot of questions about was reopening businesses. And so anytime we can talk to folks and answer questions, there's a huge amount of guidance out there. But operationalizing that guidance has been really difficult for a lot of people. And I want to take full responsibility because a lot of that's from our agency. We put out a massive amount of guidance, but we're asking business owners, we're asking schools to operationalize things that have always been done in healthcare settings. And so there's just not a lot of expertise out there on how to do that. So I'm actually an occupational medicine physician. I'm also a public health physician. So occupational medicine went out about 70 years ago when we moved away from industrialization, factories, those kinds of things. But I was in the military. And in the military, keeping our employees, our sailors, soldiers, airmen, and Marines, ready to go, ready to fight was like the most important thing, because they are our most important resources. And for you, your most important resources are your human resources. And we understand that. And so what we'd like to do is try to help you understand, if you have any questions around how do you keep your employees safe, how do you get back to work in a safe way, and how do we all work together really to stop the spread of COVID. So I think if folks have questions, that will actually kind of help direct us on what might be most valuable to you. Concerns or things you've heard, that kind of can help us direct the conversation. So feel free to use the chat box, or if you'd like to just unmute yourself, you can ask a question. And sorry that we can't take our masks off. We're actually doing this Zoom from a hotel. We have some folks kind of walking by, so if we get some background noise, I apologize. And Eric also apologizes that he can't be here. He's in a meeting with the mayor and the county leadership. And we originally thought we would take this from the Operations Center, but they're pretty full this morning. So what keeps you guys up at night? What are you most concerned about? And I'll let you think about that a little bit. And what I want to do is I want to try to set some expectations. So one of the questions we've heard often is, okay, we know what happened in March, we know what happened in April, we know what happened in August when we had a big surge in Hawaii. What can we expect going forward? And I like to tell people, if I had gotten a crystal ball when I graduated from medical school, I would be a much better doctor. And probably I could have retired because I would have won the lottery too. So I don't have a crystal ball, but I can tell you what I think and what I know to be true about trends. So in the United States, in the mainland, the first wave of cases were on the coast, and they were imported cases with local transmission. And a lot of that local transmission happened before we had testing, so we didn't know it was happening. And everybody read the stories out of Seattle, out of New York City, about absolutely everything being overwhelmed in the healthcare field. And then the Northeast started to get everything under control. The West Coast got everything under control. And then what we saw was the South. And there was absolutely no regulation in the South. And we had a huge second wave in the southern part of the United States in the summer. And then now we have a third wave of cases in the United States that are likely to be much, much worse than anything we've seen before. We're already seeing that, and it's going to last much, much longer. And that's because everything that we did in the summer is now catching up with us, because in the places where it's worse in the United States, it's cold. And so we basically just drove everybody indoors. And indoor environments are where the virus circulates most effectively because you're just close to people. And so whenever you have virus circulating in the community and you push everybody indoors, you're going to have this massive explosion of cases. And that's what we're seeing. So I'm concerned about Hawaii, and what keeps me up at night is that you have three things, see my fingers there, three things happening all at the same time. So the first is that you open for tourism. So it's true that tourists will bring some infections with them, and they're going to bring infections with them because the mainland is a disaster, right? Nobody has gotten control of things except for in the Northeast. And most of your tourism comes from the West Coast. So people want to get out of the mainland and they want to come to Hawaii because, quite frankly, your rates are some of the lowest in the country. So you have a pre-testing program in place.
True, that's why we're here.
Oh, well, thanks for coming to Hawaii. We have tourists. They're coming back. We've been through a lot of airports. We can tell you they're coming back. So tourists are going to bring, even though they're getting a pre-test, some of them are going to bring the virus with them. But, and it's an easy way to focus, but more important for you guys, and quite frankly for the community, is that when the tourists come back, people go back to work. And we want people to go back to work because our economy depends on it, and because people need to be able to feed their families, and they need to be able to pay their rent. And we want businesses to survive. But with virus circulating in the community, when people come back together at work, they're going to spread the virus because it spreads wherever we are just in close contact with people. And so people right now are mostly at home. And if they go to work, they're going to be spending 8 or 10 or 12 hours in their workspaces. So we would expect to see cases rise. Even if you didn't have tourists, if you had business restrictions and you lifted those business restrictions, we would expect cases to rise. We've seen that repeatedly over and over and over again, wherever that's happened in the United States. And it's reasonable to expect, and we should expect it. But the third thing that worries me, and we're like layering things on, is that we have 3 major holidays coming up. We have Thanksgiving, we have Christmas, and we have New Year's. And I think from your community, everybody knows what people do at Thanksgiving, Christmas, and New Year's. They all get together, right? So I'm a Howley. I think you guys can probably tell that. Catherine's a Howley. When we talk about our families getting together, you know, sometimes we're talking about maybe 6, 10 people, maybe a big family, we're talking 20 people. But when I lived on Guam, I never had a party that wasn't like 50 people that I knew, and then another 50 people who were just coming to the party. We would have big gatherings. It's how the community works. You guys know this. I'm not telling you anything you don't know. And we can't change that because honestly, those are important traditions and they're huge holidays and everybody's on vacation. So those 3 things together are going to really drive the virus in the community. Because again, it's just simply where people congregate. And even if we have really strict restrictions, which Hawaii does, you have mask mandates, you have gathering numbers of people who can gather limits, there's enforcement of isolation and quarantine, but almost half of the cases of people who have coronavirus are completely asymptomatic. So it's not that they think they're doing anything wrong. They just can infect people when they don't feel bad. So those are the things that make me really concerned. And so I am very concerned that really you're going to have huge numbers almost no matter what happens. And I think we have to be prepared for that. We have to expect that. And we have to think that's going to happen because it will change how we prepare and how we plan. We'll leave it at that for a second. Let's see if anybody has any feedback. You guys are a quiet group.
I've got a question.
Sure. Is that Julie?
This is Julie. Hi, I've got a quick question.
Please.
So as we're preparing for people to come back into the workforce, you know, we all know masks and sanitation are the 2 best things that we can do. What's the next best one? I've heard of people doing temperature checks. What else can we do to make sure all the employees are keeping safe?
Julie, I am so happy you asked that question to me because I love to answer this one. Okay, so I want you to think about, I can't see very many people. Everybody has their video off, but I'm going to assume that everybody on this call has driven a car. Miles, do we think that's true?
I think so.
Think so, okay. So when you drive a car, the biggest thing that will actually result in death for the driver is a head-on collision where you get the steering wheel into your chest. That kills people. Kills people pretty effectively, actually. So we do everything we can to prevent that from happening. So the first thing you do when you get in a car is you put your seatbelt on, right? So think of your mask as your seatbelt. The second thing that we do in every car in America today, they're sold with airbags. So I'm a federal employee. I drive a 20-year-old Honda. My Honda has airbags. So if I get in a collision, that airbag deploys. That airbag simply puts space between you and the steering wheel. So we know that when we are breathing and talking, we expel little teeny tiny respiratory droplets that have, if we're infected, the virus in them. If we're just talking normally between ourselves, see if you guys see us, Americans generally speak to each other about 3 feet apart, which is literally 1 arm length. If I do that, the virus that's in my nose, my throat, gets expelled toward my friend Katherine here. Because it has mass, that virus, those little particles drop and they end up on the ground and the virus dies. But if Katherine and I are about 3 feet apart, which again is about where Americans like to stand and speak to each other, I'm expelling little teeny tiny droplets and she's breathing them in. And she's expelling little droplets and I'm breathing them in. And we don't really think about this. You know, we think about like, oh man, when we go to the bathroom, we got to wash our hands. But every day when we're talking to people completely normally, we're breathing and sharing the same air. And if one person is infectious and you're this close, there's just a chance that they're going to breathe it in and become infected. So when we wear a mask, it's to protect my friend, because if I'm breathing out those little respiratory droplets with virus, it catches the majority of them in my mask. But the second thing we can do, which is like the airbag, is we can simply double the amount of space between us. So this is why we talk about social distancing. If we just double that space, then we're not breathing the same air, unless we're really projecting our voices. So things like singing, yelling, particularly like yelling in a spin class or an exercise class in an indoor environment, that's a problem. So we probably need more than 6 feet apart in those environments, but just give people 6 feet apart. Okay, and then the third thing that keeps you safe in your car, the steel frame around you, right? So those are the 3 things in a car. Here in Hawaii, one of your greatest natural resources is the fact that you guys have a wonderful climate. It's beautiful, that's why people come here. That's why you guys live in paradise. Get as many people as you can outside. Because getting outside provides sunlight, it provides airflow, and those are things that cause those little teeny tiny droplets to either dissipate or be dried up fast and the virus dies. So those 3 things plus washing your hands. We got to get people to wash their hands. Use hand sanitizer. That's why we put it every place. Because if you touch a surface that Katherine, who's sick, coughed all over, and I come by and I pick it up on my hands and I touch my eyes, my nose, or my mouth, the virus can be ingested, it gets on my mucous membranes, and I can be infected. But I love to say, we cannot clean our way out of COVID. We have been sold a lot of products, a lot of services to clean. In hospitals where there's a huge amount of virus, because there are a lot of sick people and we're doing a lot of invasive things to them, like putting tubes down their throats to breathe for them, where we're asking them to cough, right? Where we're asking them to take big, deep breaths. That produces a massive amount of virus into the environment. But in most environments, particularly most business environments that are not healthcare settings, that are not long-term care settings, if people are wearing their mask, if there's social distancing, if you have good ventilation, airflow, open those windows, you're not going to have massive amounts of virus. And so clean your surfaces, but get people to wash their hands. Get them to use the hand sanitizer. Okay, and I'm going to let Katherine jump in here.
And for you guys, you have some systems in place that are really protective. Your governor has mandated mask wearing, and that really helps you guys so you don't have to have that battle with every customer that walks in. Because really, your employees are the ones that are in your workplace the longest. So you want to protect them, and you need them to stay open. They want to work. You need them to work. So they're the ones you're concerned about, I would assume. Having the mask mandate means you don't have to have that battle. Everybody comes in with a mask, and that's your best first line of defense. I love, and I haven't seen this in other states, I love every business I go in has the hand sanitizer before you even get to the door. It says it's required. Everybody does it. People are doing it really well. And I love seeing that. I would encourage as much as possible, if you can encourage people, if there's a line, to wait outside. If they have ordered and they're waiting for their food, to wait outside, we'll bring it out to you. Get people out of your business, because again, the fewer people, the more distance. So those kinds of small solutions that don't cost anything, you really just, the more we can focus on keeping people from getting sick in the first place, the better off we are. And I see the first question in the chat is, will wearing masks all the time out in public help? And I'm gonna let Anne jump in with that, because I think she has the numbers on that.
Yeah, so it turns out that if you just wearing masks, and these are from like big outbreaks in places that were enclosed. So one of the studies comes from the Theodore Roosevelt, which I think probably you guys read about. It was the ship that pulled into Guam. Wearing face masks decreased the risk of infection by 70%. So that's really high. So if you put the masks and the social distancing and move everything out and wash your hands, you know, we could get the vast majority of transmission under control. And the other thing I just want to say about wearing masks is it becomes a norm, right? So it's about leadership. It's always like, for anybody who has kids, you know, if you run a business, you have employees, you know, people do what they see. So you can say, hey, I need you to do X, Y, and Z. But if you as a boss comes in and you don't do those things, then employees feel empowered, like, hey, they don't have to do those things either. So when we wear a mask and everybody's wearing a mask, it becomes a norm. And so I said this to the police, but like, you know, I've been here for 3 weeks now. You guys have beautiful weather, great temperature. I haven't seen anybody without pants on, right? I mean, haven't seen anybody, because it's a cultural norm, but also because people will be cited. So, you know, but if you can make things a cultural norm, then you don't have to, there's less enforcement. And we don't want to have to enforce things if we don't have to. But if everybody's doing it, then the person who doesn't starts to feel abnormal, right? It's social pressure.
Can you talk to how state and county are prepared for flu and COVID?
Yeah. Oh, sorry, Miles, go ahead.
Yeah, while we're talking about masks, and before I jump to a question from one of our grocery retailers, you know, I just saw some that the CDC shared some information the other day about how mask wearing protects the wearer. Can you expand on that, please?
Yeah, so initially, you know, when this whole thing started, when COVID started and your whole world's changed, and, you know, uncertainty and change became the norm, we think of masks in the healthcare industry as protecting the wearer. So there have always been sort of two kind of masks. There are those N95 respirators that we wear in hospitals, and we tend to wear them in very, very specific situations. Mostly around patients who have tuberculosis, or we're worried have tuberculosis. And so I'm actually an old TB doc. I used to do TB 24/7 for CDC. So we think of those masks as protecting healthcare workers from getting an infection from patients. And that's what they do. And then the second mask we had was surgical masks. And surgical masks actually help prevent us as healthcare workers from breathing on patients. So if you think about like a surgeon in an operation, they're not breathing into the sterile field. But it also protects the healthcare worker from splashes. Right? So if you're doing a procedure and there's blood or other bodily fluids, you're not getting that on your face. And we do that with shields too, or eye protection. And also we do it in other industries, right? So we use N95s for dust control for our employees, in painting or in sanding operations. So there are a lot of different industries that use N95 respirators or other kinds of respirators to protect the employee. And then there are these other masks, like surgical masks, like face shields, that protect against splashing. So when we said, so when we talked about using face masks like this, like I'm using, so I actually have on a, I don't know if you can see it, it's a you know, sort of baby blue cloth mask. It has 2 layers, and I think my husband bought it at Target. We felt fairly confident that it would protect some, it would help prevent some of those respiratory virus-laden particles, those little respiratory droplets, from reaching the air in front of us. But what we didn't really know, because we've never studied it before, was does it actually protect the wearer? Because it's just air that you're breathing in. And you know, some of that virus is going to get stuck on the front, but viruses are little teeny tiny. And so could some of them get into your nose and mouth through the mask? And it turns out at the beginning, we didn't have any data, and we did not communicate this well. And it was a communications disaster, and I'm going to take ownership of that. We have not communicated this well, but it does turn out now we have good data to show that it actually protects the wearer and your friends. There's probably more benefit to people who are there, according to the literature, according to the science. There is more benefit to the people around you, but there is also some benefit to you. So it's kind of a twofer, and we like those. So please wear your masks. And it doesn't, another question I get often is, should I be wearing a surgical mask? Surgical masks do a little bit better than cloth face masks. But if everybody's wearing them, and the other thing about cloth masks is they're inexpensive. You can throw them in the washer and dryer. You can change them out. Surgical masks right now are incredibly expensive. I've seen boxes of them for like $30, $40, $50 for 50 masks. And there's an environmental consequence, right? We're creating a ton of waste. And so I like the fact that they're reusable. You can throw them in your car. You can have fresh ones in your purse or your bag, you know, and they're available. So I would say go with the cloth face mask. Please, you know, we don't have as big a shortage as we did, but surgical masks we try to keep for people who are in hospital settings, long-term care settings. And then those N95s, again, that's a level of protection that we think of generally for people who are at increased risk of being around people who we expect have infections. So healthcare workers, long-term care workers, some of our other first responders and essential personnel.
Thank you. There was a question that came, in fact, our first question came to me privately from in fact, one of our largest grocery retailers. The question is, in our business, we have associates like cashiers, courtesy clerks, who work in a shift together. They would likely be considered close contact in a positive situation. It's difficult to split shifts. Do you have a way to mitigate this?
Yeah, so this is an issue, and honestly, those forward-facing customer positions are at highest risk, and we've seen that across the United States, right? Clerks, grocery store workers, because they're just interacting with the public, and it's difficult to understand people. It's difficult to hear people when they have masks on, and so what we do is, which is just natural, we lean in, and the worker leans in too. And so they actually are really close to each other, which is part of the reason that we put up those physical barriers, right? If you think about a physical barrier, like, I mean, there's airflow over it, there's airflow around it, but it's simply just to keep people apart. So as much as you can do to keep your workers apart, again, it's that mask, it's that physical distance, and increase your ventilation as much as you can. We think of fans as blowing on us because that's what cools us down. It makes us feel cooler because there's air blowing on us. Most of the cases, if we can open things up and we can take those fans and actually suck air out, so actually the back of the fan is in your workspace and it's blowing air out, like that's actually how we increase the ventilation. Now, I know most of your places are going to be air conditioned, right? Because it's hot here. And more importantly, it's incredibly humid. And if you don't air condition, you're going to have mold absolutely everywhere. So how do you do that? So people have said, well, do I need to change out, like if I read the guidance, do I need to change out my filters? Like really? So filters are actually more efficient when they're slightly dirty. If you think about it, it kind of makes sense, right? Because when they're completely clean, they actually have bigger air pockets for the air. And as they get slightly dirty, then it actually catches more stuff. And then once they get so dirty that they get clogged, then they don't work as well anymore. And a lot of times the air just goes around them. So what you can do is make sure that you're changing your filters on your schedule. Talk to your HVAC guy. If you can put HEPA filters in place, particularly in small enclosed spaces, that's great. If you can not recirculate your air, that's great. Hospitals do 15 to 20 air exchanges per hour. So literally they're taking fresh air in, they're cooling it, and it is pumping it right out. Right, so every 3 minutes, they're literally getting a new fresh cycle of air. The problem is for your businesses, that's probably absolutely not practical, right? Hospitals are built to do that. But you can probably take some steps to get fresh air in as opposed to completely recirculating your air. Now, I want to be completely upfront on this. It costs more money, right? Because there's a cost to electricity. And if you're, every time you pull a fresh air load in and you have to cool it by taking all that water out, it increases your electricity bills. Also, your AC does not work as efficiently because they're not meant to do that. And so if you normally keep your business at, I don't know, say 72, or you're like, just like your house, right? If you go to the more air recirculation you have, or sorry, more fresh air exchanges you have per hour, the higher your temperature is going to be, right? Because when you recirculate air, you don't have to cool it all over again. And so you can push those temperatures down lower. So this is also true in cars. The first thing we do when we get into our car is we turn on the AC and we hit that recirc button because it gets our car cooler faster. Same thing in businesses, same thing at your home. So we also like tight buildings. Here, I think this is maybe less of a problem than like in the mainland and particularly in cold climates, but actually leaky buildings right now are good for us. And buildings that have windows and have doors that we can open, get that air circulating. That's gonna be good for your employees. And it's gonna be good for your customers too. People just don't like it because they're gonna be warm.
Thank you.
Sure. What's the next question? Oh, there was one question. I don't know if I answered it fully. So does making customers do a temperature check at the door really make a difference? So CDC has put out guidance that we don't suggest this for most businesses or schools. In part because if you stand outside with a temperature check, you're not going to find most people because most people are asymptomatic or they don't have symptoms when they're still coming to the store. You may find a couple people, but it's a lot of work on the front end. It also puts your employee who's out there doing that at risk. And so we recommend against doing that. It also gives people a false sense of security. I actually personally think you'd be better off making sure everybody's got the mask on, that they're staying away from each other, they're washing their hands, and as much ventilation as you can get. So thinking about, how do you get customers to be comfortable outside? I've seen a lot of stuff. We've seen a lot of visual cues on the ground, tape or signs on the floors. I think that's great. Anything you can do to give people visual cues is helpful, both for the employees and for your customers.
Can you talk about break rooms?
Oh, I do. I want to talk about break rooms. Catherine
That's what I'm here for.
Yeah, Catherine keeps back. You can tell who likes to talk. Okay, so I want to talk about where your risk areas are in your business. Particularly, so I don't have a good sense. I only have people's names in front of me, so I don't have a good sense of like what kind of businesses you represent. But break rooms are a huge issue because it's where people get together. They take off their masks, because they're going to eat. And break rooms are almost always interior. They're usually tight spaces, and people hang out in there. And we let down our guard when we're in normal spaces that we know, with people we know, eating, we're just being normal, right? But when your employees come back to work, if they all haven't been, working together and you're bringing people back, the very first thing people do is they go like this. Hey, like, did you hear about like what happened and what have you been doing? And they want to show you.
Here, look what's on my phone.
And they just get close to each other. And so we don't think about this, but break rooms tend to be some of the highest risk places in your businesses.
Because it's easy to fall back into bad habits.
Yeah. And remember, it's those employees who've been exposed out in the community who are coming back to work, and then they transmit their viruses, or they get it from a customer and then they transmit the virus. So the other place that we see often is people say, I've done everything right in my workplace. I have a construction site. I mean, construction sites are great. Everybody's outdoors. And we say, okay, where do your guys eat? And they say, oh, they go to their truck, they roll up the windows, turn on the air conditioning, and they sit for an hour and they eat. Well, I mean, that's just a setup right there. Or they all come to work and they drive an hour from the other side of the island, and they're sharing that recirculated air. So think about those things too. You can't control a lot of that, but if you message and give people reminders, that helps. The other thing that we know, I think everybody here knows, is that employees will do things when you're watching them, right? It's called the Hawthorne Effect. It's a very popular thing in industrial psychology, in factories. If we're watched, we implement behaviors better, right? We know this. Like, your kid will do something when you have eyes on them. Your employee will do it the right way when you have eyes on them. I was driving. You guys have a lot of one-way streets here. I was driving the other day, and I wanted to do a U-turn because I was going the wrong way. And so what was the first thing I did? I looked up to see if there was a camera. And of course, there were 2 cameras. So I did not do a U-turn. If there had not been cameras there, I probably would have done the U-turn. But I can't have, federal employees getting tickets in Hawaii, not a good thing. So I would also say, as much as you can get folks to think like, hey, somebody's keeping an eye on this. And that means initially doing some enforcement, but not heavy-handed, in a way that says, listen, I want to keep you at work. I want to keep my business open. I want you to be safe, so that you can confidently go home to your family, your wife, your kids, your husband, your grandparents, and not take virus home to them. Because people are scared, they're afraid, they're fearful, but there's a balance. They have to work. They want to work. They want out of their houses. They've been stuck in their houses with their kids, driving them crazy now for months. Right? They want to get out. They want to be back at work, but they're afraid. So we have to give them the tools so that they can be confident that we're protecting them, so they're not taking that virus home.
And I'll jump in on that. And just one of my personal observations, so for those of you who have desk workers, you have office space and you have more than one person in an office. One of my personal areas of concern is when I'm sitting at a desk all day long, is I start out with my coffee, and I might have, some fruit left over from breakfast, and I'm sort of grazing all day long. I'm sipping on my coffee, I'm eating grapes, and then it's lunchtime, and I break out lunch and I eat at my desk. So make sure to communicate to your employees, give them time to get out of the office, go outside to the parking lot, take off your mask, hydrate, drink your coffee, do your break, like physically get away from your desk, because my biggest concern is that we forget to put our masks back on, or that we end up sitting at our desk for an hour or so without a mask on because we're eating lunch. So making sure they are reminded to sort of do those things away from the desk, particularly if you're in a shared space. Because again, it's just falling back into what's habitual for us. We've always done it a certain way. And right now we can't do it that way.
Yes, ask in the chat, was a 70% reduction. So that actually was with cloth masks. That was with cloth masks.
As long as they're double layered, that's the recommendation, is that your cloth masks have 2 layers on them.
Oh, and I think Miles just masked up for us.
Just, just having you two in masks right in front of me kind of triggered something in there. There's a great question that came up regarding the flu season. It's one of the earlier questions. It says, I believe last year was the worst recorded flu season in a very long time. With us heading into the flu season, how are we, state, county, healthcare, preparing for both?
Yeah, so this is actually this is a good lead in. So I do want to say that we as CDC only almost ever get invited into a state when things are really, really bad, right? Usually when it's a disaster and there's nobody else to clean it up, and usually because somebody wants to blame somebody else and we get to go home. And so, and sometimes we can bring resources that other places don't have. And sometimes that's financial resources, sometimes it's human resources, sometimes it's technical assistance. But I do want to iterate here that we have been absolutely nothing but impressed by Hawaii. Like literally, we're here as extra hands to help out Hawaii, but you guys are doing an incredible job. We have been to states that are not doing an incredible job. And it was an uphill battle the whole way. So your Department of Health, your entire government is really doing an incredible job, but it also relies on you and the community. And so I do want to say that, and that leads into the flu vaccination question, as well as the COVID vaccination question, which is also what people want to know about. So Hawaii actually, and actually every state in the union, has plans to deliver flu vaccine every single year. And then this year too, they had to put a COVID vaccine plan together. And I think they were due like about 5 weeks ago. And there's a huge group of folks at the county level, the state level, and the federal level who are working on those vaccine distribution plans. One of the issues this year with flu is we are very concerned about the twin viruses circulating. We have a good flu vaccine. It's not perfect, but it's really good. I get my flu vaccine every year. Please get your flu vaccine. Ask everybody to get their flu vaccine. They're giving them for free every place. Encourage your employees to get the flu vaccine. And it's simply because if they get the flu, we want to know that we don't want people to get the flu and then we have to figure out, is it the flu? Is it COVID? Is it both? Neither? Right? It helps us kind of decrease the possibilities. And at the beginning of the COVID crisis, people were infected with both. And it's difficult to treat two if you only have to treat one, right? So just help yourselves out here. There's not a lot of flu circulating right now. Normally we would see a huge increase starting in November. We know from other countries in the Southern Hemisphere who've been through this. So they're in the Southern Hemisphere. Our summer is their flu season because it's their winter. They did not see a lot of flu circulating this year. It was pretty much just all COVID. We don't know what's going to happen. I suspect we will see less flu, but we are also really pushing flu vaccine. So maybe also part of it is because we're doing a great job preventing it. There's a little bit, but there's not a ton. So if you can get yourselves vaccinated, get your folks, your parents, your grandparents, your kids, get everybody vaccinated. I will say I'm concerned because a lot of flu vaccine in Hawaii is actually pushed out through the schools. And so schools are not doing vaccination campaigns as effectively because nobody's in school. And so by now they would have already, I think I heard some numbers out of one of the complexes, they would have already done about 20,000 flu vaccines and they've done about 2,000. It's just being able to reach people. So there are vaccination systems in place. We're using those systems. We're going to use those systems to push out COVID vaccine when it's available, but we're a long way from the population being able to get COVID vaccination. And unfortunately, I don't have a crystal ball, so I can't tell you exactly when, but we're a long way away from that. It's not going to happen by the first of the year, and it's probably not going to happen before what we would consider the respiratory virus season, which is the winter in the mainland. Okay, hopefully I got that one. If you UV, let me answer this question. I got this a couple of times. If you UV your masks using the UV units being sold, will this kill the virus? So UV light will kill virus. It's like sunlight, right? It's like capturing a little bit of sunlight there. Honestly, if you're not in a healthcare setting, I would say wear a cloth mask and throw it in your washer and dryer. It's a lot cheaper. You're going to do your laundry anyway. And if you only have a washing machine, throw it in the washing machine and then just hang it out to dry on a line, and you're good to go. We are using UV light units in hospitals. We're extending the life of respirators. Most respirators, we think of generally as single use, and we toss them. Most respirators actually, by manufacturer instructions, can be used up to 5 times. There are low-tech ways and there are higher-tech ways. UV light is one of the higher-tech ways. I've seen TSA using UV light to pass the trays that you put your stuff in to go through security. Pass the tray, under a UV light, presumably to protect the workers, because it's your stuff and then you're going to pick it right back up. But I guess, the workers are coming into contact with those bins. So I think it's an expensive solution when there might be less expensive options available to you that work just as well.
And UV typically works better on hard surfaces than cloth. Yeah. So that's a consideration. And actually, the recommendation we have for healthcare is to rotate masks. Take a mask off, put it in a paper bag so the mask can dry inside the bag and the moisture will dissipate out of the bag. It won't mold. Take it off, put on a clean mask, and don't use that mask for at least 3 days.
So, but for cloth masks, just wash them. Okay. What else do we have, Miles?
Let's see. Question, what is the best way you have seen employees deal with the public that don't wear their mask when approaching employees, indoor or outdoor?
Yeah, that's a great question. I mean, so Atlanta is the only federal agency that's not headquartered in Washington, D.C. We're headquartered in Atlanta, Georgia. I know Atlanta, Georgia is a long way from Hawaii. We have a governor who does not believe that anybody's rights should be infringed upon. So everybody should be able to carry a gun and everybody should not have to wear a mask. And those two things together are actually a bad combination. So we've had a lot of altercations in our state and across the southern states. I think part of it is figuring out what is acceptable to you as a business and empowering your employees. And there's actually a lot of training out there on de-escalating. You guys, a lot of you are in the hospitality business. We deal with difficult customers, difficult clients, elevating things. Sometimes it's asking, can we take this conversation outdoors? Really like just taking the person out of the space. I know a lot of you, it's probably there's this balance, like, I don't want to lose a customer. I have a limited pool of customers. Where am I comfortable? But I would say in this case, you're protecting your workers. This is about protecting your workers because they're the people who are on the front lines. They're the ones who are most at risk. And so thinking about through de-escalation, redirection, I think those are probably the best solutions. And then making things very clear, because it's much easier to prevent somebody from coming in than getting somebody out once they've gotten into your business and your establishment, right? I think we all know that. And so thinking through how it works. The other thing I find with employees is if we role play things, people get good at it and they get more comfortable. And if we tend to deal with a problem as soon as it happens in a confident manner with, again, redirection, de-escalation techniques, moving things outside, right? And if your employees feel confident, if they practice those skills, they're more likely to use them. And that actually will protect them. I've been in situations, obviously I'm a healthcare worker, I'm on the front lines, we're traveling a lot. I did at the beginning of this We screened 2,700 homeless shelter residents, staff, and people who live unsheltered in Atlanta. And I was at the gas station, and I had my mask on, and there's no mask mandate in our state. At the time, there wasn't in our county. So I'm putting gas in my car. I have my mask on, and some guy starts screaming at me. I mean, he's just screaming. Yeah, I turn, and he's like screaming about why I'm wearing a mask. And I said, you know what, sir? I'm a healthcare worker. I'm trying to prevent you from getting sick because I might have COVID. I'm trying to do the right thing here. And he just stopped. He didn't say, I'm sorry. He didn't say, oh, anything. He just stopped, but he turned around and got out of my face. But he's kind of coming at me, right? And you sort of think is that the right thing? I don't know. I'm kind of glad he didn't have a gun. But I think the more that we can practice, work with your employees, get them comfortable. We're all learning these things together.
I also think you guys have the benefit of being able to sort of blame the regulations above you. That these are state rules that mandate mask wearing. Also, people want Hawaii to be open. Tourists want to come, and people want to be at work, and so possibly framing it in the way of this helps us stay open. It helps us protect our employees. Different people might respond to different messaging, but people want Hawaii to be open. So reminding them that this helps us stay open. It helps us keep our positivity percents down, and so that we can serve you.
I think the other thing, as much as you can do to personalize things. So every group I've talked to, so my sister is also a healthcare worker. She's a nurse practitioner. She works in a pediatric practice. She got COVID. She was doing everything. She was actually wearing an N95 in her practice. I don't know that she got it at her practice. That's her highest risk of exposure. She's got small kids. So she was positive, and she was really scared. And she was most scared that she's going to take it home to her husband and kids. She had the luxury of having a separate bathroom and bedroom. Her kids didn't get sick. Her husband didn't get sick. So I think as much as you can personalize things too, you guys are a small community. There's around 200,000 people on your whole island. Everybody knows everybody. And soon everybody's going to know somebody who's had COVID. So I think that's the other thing. Really trying to get to talk to people where they are and personalize things. People tend to respond to that so much better than they respond to science, for instance, or facts and figures. Anything that kind of makes us feel something is better there's a better chance we're going to change our behavior. But ultimately, this is about changing behavior. And that's what Katherine does. It's incredibly hard to change people's behavior.
It's true. We've had several campaigns going out or that are out there encouraging mask wearing. You may have heard about the hashtag Our Kuleana campaign, and we have others, other health organizations. Yep. So thanks, I appreciate that thought, and I'm hoping that they're listening in as far as your recommendations, because they are taking that personal approach and reach in their efforts to reach out to people. I have one question came in regarding outbreaks. We had outbreaks in our local long-term healthcare facilities, like our Yukio Okutsu Veterans Home. How long would you recommend these problematic facilities who have now shown control to keep up surveillance, and how often?
Yeah, so there's actually a lot of guidance around long-term healthcare facilities, and so the state of Hawaii hired a new person. Her name is Kelly O'Leary. She's actually an infection prevention specialist. She's working on hospital-acquired infections. There are testing guidelines for long-term care facilities and hospitals that have outbreaks. So initially, everybody in the facility, so all workers, all residents are getting tested on usually it's every 3 to 7 days. It depends on kind of how the long-term care facility is set up, for an extended period of time. So normally it will go through 2 weeks as long as they have no secondary cases. So it depends on how many cases they have and then how long that keeps rolling. But there's actually really specific guidance around that for long-term facilities. And if somebody is actually in that business, or somebody wants more information, I would be happy to put them in touch with Kelly. That's kind of a lot of factors to consider there, but there are very good guidelines, and using those guidelines, and also going in and doing visits, ensuring that it's all the other infection prevention and control measures are in place, which a lot of those are actually required by CMS, so the Centers for Medicare and Medicaid Services, and then the regulatory agencies, making sure all of those things are in place. They've been able to get the outbreaks under control, but unfortunately, as everybody knows here and on the mainland, this population has been incredibly impacted, and the largest percentage of deaths that we've seen has been in long-term care facility residents. And my heart and my thoughts and my prayers go out to the families, particularly those of veterans, right? I mean, I can't imagine. I'm a veteran. Yesterday we celebrated Veterans Day, so I'm sorry for your community, and we've seen it unfortunately in other veterans long-term care facilities in the United States. It's devastating. I will say that one thing, this is actually a good transition. One thing that people say, like, okay, if there's one thing I could do, what would it be? And maybe we've talked about a lot of prevention mitigation measures. So we found out that the one thing that made a difference in long-term care facilities preventing outbreaks was ask the employees to self-screen at home before they come to work. Take their temperature. Do they have any new symptoms or worsening of symptoms, right? Cough, sore throat, nasal congestion, shortness of breath, like all of those symptoms, change in taste, change in smell. There's like a whole list of them. And if they say yes, we ask them to stay at home. We ask them to get tested. We ask them to have their families tested, and we pay them. So we probably all know this, but healthcare workers in long-term care facilities are some of the lowest paid staff. These are people who have to work. They can't normally stay home because they have to work because they have to earn money. And so if they feel like they have to go to work, and they will go to work, and if they introduce the virus into the community, into that long-term care facility, it just goes wild. And those are the most vulnerable people. And so what we know is in most cases, it is employees bringing in the virus. And it's hard because we live in a world, in a business world of very narrow profit margins. I understand that. But when people say, we hear this routinely, employees say to us, I have to use my PTO. Like if I go get tested, I have to use my PTO. If I stay home, I have to use my PTO. And I think you guys know, because I do this too, right? We like to save up our PTO because it's hard to go anyplace here. Like it takes time. You got to go off the island. You can't go off the island for 12 hours. You want to go for a period, you kind of save that up. Or people don't have PTO. They don't have paid time off. So it's a balance. We've asked a lot of employers, are people abusing this? And what we've heard is, we've certainly heard some anecdotes, but for the most part, overwhelmingly, everybody we've talked to said when we instituted that policy, we were pretty surprised. We thought people were gonna really abuse it. Most people really want to come back to work, and that gives them an incentive not to come to work sick. But I know it's on you guys. I know your backs are to the wall. I know a lot of you did the right thing on the front end and did as much as you could. You kept people on payroll as long as you could. You kept paying medical benefits as long as you could. You guys do have free testing in the community. It's what we would call surveillance testing. So it's surveillance screening and testing. So it's people we don't think are sick. But if the other thing you can do as employers is encourage your employees to get tested. Use those services, even if they're feeling well. And if you encourage them, often they'll do it when they think they might have been exposed. So if they went to a party where everybody was watching football and drinking beer and there were 25 guys there, like they probably know they're at risk. Encourage them to go get tested. Generally, employees and children are under tested because we do testing during the working hours, 7 to 3 p.m. when most employees are at work. So if you can encourage your employees, give them an hour, let them go get tested, tell them to take one of their kids with them and get tested. That gives us an idea of what's happening in the community. And we can make some decisions based on that. It helps us figure out what level we need to be at for mitigation measures, right? Because it's a balance between having things open, but keeping the virus under control. Okay, I know we're right about an hour. Miles, this is your show. What?
Well, I think, well, I just wanted to give you two an opportunity to share any closing thoughts. I mean, words of wisdom just kind of, you just blew it away. I mean, it's like, we so appreciate what you're doing for us. You know, this thoughtful, really thoughtful conversation, I think it will help our businesses. But let's see, Katherine, any closing thoughts?
Yeah, I'll say something Anna said quite a few times to different groups, and that is that we're building the plane as we're flying it. I'm sure you guys were all back in March starting to figure out what do you need to do to stay open. And as soon as you get a plan together, something changes. And then you're still trying to figure out, okay, now what do we need to do to adjust to this? And this is just the nature of the beast. This is changing so quickly. None of us have ever had to deal with this. One of the DOH workers likes to say, this is my first pandemic. It's my first pandemic as well. So we don't have the rule book. We don't have the magic answer right now. So keep doing what you're doing. Make your plans. Be ready to adjust those plans as needed. You know, have some ideas like what happens if X, Y, and Z were to happen? What would we do differently? But you guys are doing a great job, and really just do your best to be prepared, but be prepared for things to change. And just communicate with each other. You guys are your best resource because I like to say CDC puts out guidance. We try to let people know sort of the big picture of how things might work, but you guys know your community and you know your businesses. You know what works best here. You're the experts on that. And now you're the experts on living through a pandemic on Hawaii and trying to keep a business open. So follow the rules you have to, and then look at the guidance and see what's going to work. Use your common sense and apply what you can to the best of your ability. And just remember, it's about layering those protective things. So what we can do, you know, masks may reduce it 70%. So then we also want the space, and we also want, you know, as few people in our businesses as possible. It's the more of those things we can layer on top, the better off we'll all be for as long as possible. Last thoughts, Anne?
Yeah, actually, I have a couple things. So first of all, I want to say I kind of said from the beginning that I think that this is a failure of imagination in large part. We don't like to change, just people. We have a way of doing things, we have a process, and that's what we want to do. There's a massive amount of uncertainty. There's a massive amount of change that we've asked everybody to do. People want to come back to the workplace and do like something that they know how to do that hasn't changed. But things have to change. This is a time to rethink how you're doing business. Like if you've always used a break room, take some picnic tables and put them outside. Tell your folks to go outside. I know it rains here a lot on this side of the island, but there's a ton of stuff that's covered because it rains a lot. Right? I mean, there's covered parking, there's pavilions, there's overhangs, there's lanai, there are places that you can do things. It's just a different way of conceiving how you do business. Be creative and share those. But the other thing too is now is the time, you're getting a new mayor. now is the time, if you as a business community need things to change, because it would help you, now's the time to ask. I think everybody across the country is rethinking rules, regulations, how things are done by statute, legislation. For instance, in our state in Georgia, we have tons of blue laws. We control everybody's alcohol. I mean, like, that's all we control. Guns, you're okay. No mask, you're okay. But we want you to only drink where we tell you to drink. So one of the things they've done is they've allowed people to have alcohol. Businesses can sell alcohol in to-go cups. They can sell beers by the can. They can sell wine by the bottle. And they're allowing people to consume with a number of yards, I think, or feet of that business establishment. A lot of places have shut down parking lots. They put up tents and they've just spaced out people and they moved everything outdoors. That will actually bring people. You guys have gorgeous weather here. People come here for the weather, right? They want to be outside. So, I think using some of these kinds of techniques. The other thing I want to say, so be imaginative, share it. And if you have asks, I think this is the time. My sense, we met with your mayor, and the outgoing mayor, and we met with the new mayor-elect. And we said, hey, people are going to want to talk to you, right? He's the incoming guy. You said, this is a great opportunity for you to give consistent messaging, but also rethink some of your processes that will help your business. It'll help tourism. It'll help people get back to normal in a safe way. Okay, so that's the first thing. The second thing is I want to hit the issue of contacts, close contacts. So one of the things so close contacts are people who, if you have a case, people who have been within 6 feet of the case, the person who's sick or infectious, for a cumulative time of 15 minutes or greater in a 24-hour period, okay? So if you are just in the same workspace, but you sit 30 feet apart and you're not in a break room together, and you come in at one time and your office worker comes in at another time, and you guys talk across with your masks on and you talk across the space, you're not a close contact just because you were in that space. Now, if when that case gets called, the Department of Health is going to call them and they're going to say, who are your close contacts? And the first ones they start with are your family members, because that's where you spend the most of your time. It's where you sleep. It's where you do all your breathing, right? And so your family members are always going to be your close contacts for the most part. They're the people who are in your household. And then the next thing we ask, particularly working age adults, we say, where do you work? Who was in your workspaces and who did you have 15 minutes or more time with within 6 feet? Or unmasked time that was close, right? So there are a few caveats, like, if you're going out on smoke breaks and you're standing like this because you're sharing your cigarette back and forth and you're breathing on each other without a mask, we try to have some flexibility there, but we're talking about 15 minutes or more within 6 feet of space. So it's possible that the person who's the case is going to say, okay, yeah, so Kat and I are close contacts. I work really closely with her. We've been traveling together. We're doing Zoom calls together. She's my close contact. But I also spent a lot of time in the ops center this week. There were a lot of people in the ops center. And one person in particular who kept walking towards me as he's wanting to take off his mask to talk to me, I just keep walking backwards. And I eventually pulled him outside the ops center, the county recreation center that they're using. And we had a conversation outside, right? Because we are potentially at risk because we've been traveling. We've been interacting with lots of people. We try to do it as safely as we can. But I don't want to put him at risk. I don't want to put other people there at risk, but also those other people are not my close contacts because I never spent more than 15 minutes or more with them within 6 feet. So one of the things that we have to do is get this across to our employees, because often we'll say, oh, we're going to close down our workspace. Everybody go home. And we're doing it often because we just want to assess the situation. Sometimes we want to do cleaning, right? We want to make sure it's safe when we reopen. But that tells our employees, oh, we're all close contacts. And then they're expecting a call from the DOH. And then they're actually really upset when they don't get a call from the DOH within 24 hours. And it's because they're actually not close contacts. Because right now, the Hawaii DOH, District Health Office, actually DHO, has about 50 cases and 300 contacts that they're monitoring. And they're adding about 20 cases a day. So this is a huge operation. They just simply don't have the bandwidth to call people and say, hey, sorry, you're not a close contact. And they would love to, they can't do it. They don't have enough bandwidth. And those are people who really are not at risk. So just to kind of get that message of, there's close contacts, and then sometimes there's like contacts of contacts, but contacts of contacts are not a thing. Okay, I want to make sure I hit that one. That we get that a lot of
Thank you.
schools. Yeah.
Gosh, we could keep you here all day.
I know, and you guys are busy people who have jobs, right?
No.
And this is our job, so so we really appreciate it. We will talk to anybody who will talk to us, mostly because the guidance is overwhelming. It's operationalizing. There's so much we don't even know like how to put all the pieces together. Use your common sense. Please share things that work amongst yourselves. Get the messages out. All of you guys are going to be going to Thanksgiving, Christmas, New Year's. Talk to your families. Don't just talk to your employees, but talk to your families. Talk to people who listen to you. You guys are business leaders. People listen to you in your community. You have an opportunity to give simple, clear, consistent messaging. And if everybody's hearing that simple, clear, consistent messaging over time, we hope people are getting the message. We really appreciate it. We're here until tomorrow, and then we're on our way to Kauai. But we honestly have been nothing but impressed. We absolutely appreciate that you're open. We're at hotels, we're renting cars, we're at restaurants, we've been in grocery stores, we've been in schools, we've been in multiple settings. We're so impressed. You guys are doing an incredible job. Please take care of your employees, take care of yourselves, take care of your businesses. Also, please be kind and be generous to each other and to yourselves. Incredible uncertainty right now, lots of change. It's an incredibly difficult time for everybody. Take time for yourselves and make sure you are also ready to go 100%. We have to take a break every once in a while so we can recharge, so we can be there for others.
Yeah, take care of yourselves. You guys are on the front lines.
Thank you so much. I mean, that was really an inspiring message. So thank you. I've got to throw in a commercial in here.
Absolutely.
Just to remind our businesses that if you ever need professional cleaning services, we do have members that can help you with that. So check out our member directory on our website and contact some of those places and see if they can help you out. But Dr. Buff, Dr. Center, thank you so much. We're taking away a whole lot of information that I know will help our community and our businesses. So thank you. Thank you to our audience for being here. Thanks for taking the time. Take care. Wear your mask. Wash your hands. Keep distanced. And continue to
get outside.
Get outside.
It also helps with mental health. Get outside. Thank you, Miles, and thank you. Thank you.
Thank you.
Aloha, everybody.
Aloha.